Welcome, everybody. It's the Radio Surgery Show with Dr. Gil Liederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Liederman.
Good morning. This is Dr. Gil Liederman, live from ABC Studios in the heart of New York City. I'm here with John Taransky, who's writing co-pilot today.
That's it. Good morning, Doctor. How are you?
Fine, thank God. How are you?
Outstanding.
We're here to talk a lot about new issues in oncology, news. We're here to answer your questions. You're welcome to call us in at the WABC Studios at 1-800-848-9222. Again, 1-800-848-9222. We're here to interview experts in the field, answer your questions, and bring news, and also to discuss interesting cases of the week, patients that I've seen over the week that have some reason to discuss, or interesting points, or things we can all learn from. So I hope everyone's having a good day, and I hope we have a great time on the show this morning. First thing I want to talk about is how to save lives. And obviously, as an oncologist, we want to save lives. The best thing is a person who never gets cancer or who's diagnosed at an early stage so that the cancer can be treated and the patient lives a normal life. So last week we talked about cervix cancer and saving tens of thousands of lives with simple testing.
What was it, 10 cents, Doctor?
Yeah, it was doing special stains on the cervix using vinegar, right, identifying lesions of the cervix, and identifying, especially in low-income countries where access to health care isn't so prevalent, the ability to find the cervix cancer early and treat the patient before the cancer spreads and causes harm. So similarly, there's another study out, brand new study, that looks at lung cancer and early screening. This kind of work has been going on for probably now a decade, and there's a new report out. So for patients who are really for people who are smokers or ex-smokers, even though you're an ex-smoker, 10 years out from smoking, there's still a significant risk, more than double of the normal population, of developing lung cancer. So the question is really how to find the lung cancer when it's early, treatable, and most likely curable. And the most recent study was presented at ASCO, which is a National Society of Oncologists or Cancer Doctors. And doctors looked at screening with CAT scans versus chest x-rays. So chest x-ray is an old-style way of looking at the chest, the lungs, the heart, the mediastinum. The mediastinum is a tissue between the right and left lung. Did you know it? Did you ever hear that word before, John?
No, I can't say that I have, Doctor.
So it's a big part of our body. The mediastinum has
sure.
a lot of stuff in it. It has the heart, the esophagus, lymph nodes, the airway. So it's a big part of our body, but it's not so sexy, so people don't talk about it very much. We don't talk about Angelina Jolie's mediastinum.
Right.
We're going to talk about her breasts later in the program if we have time. So there's a way of doing CAT scans. CAT scans are images of planes of the chest. Rather than to see the whole chest on one piece of x-ray film or one view, you can get dozens or more views of the lung, so it's finer cuts. And it's estimated that if you do low-dose CAT scans of the chest in patients or people who were smokers or ex-smokers, you can actually reduce lung cancer deaths by about 12,000 a year in America.
Wow.
So you're talking about, again, huge numbers of people affected if they only would go about this testing.
Sure.
The testing is easy. It's non-contrast, so there's no injections. The scan probably takes 2 or 3 minutes. It's very fast. And you then see if you have any nodules or anything that brings attention to further care. If there's nothing there, you can get a scan the next year. The first scan picks up the most patients because you're getting all the new information for that patient for all their life, pretty much. And then the annual scans just pick up the difference, what's happened since the last scan.
Now, doctor, let me ask you a question. How often should a patient, have a CAT scan?
Well, there's a bit of a problem, and some of the insurances will not pay for screening CAT scans. So a lot of the health insurance will pay for taking care of you if you're sick, but they may not pay for you if you're not sick. And so probably in smokers or ex-smokers, probably annually, and then based upon that, a certain regularity. The most invasive cancers, biggest cancers, are picked up with the first screening. So I would really urge people who are smokers to stop, of course, and if that's possible. And for people who are ex-smokers to try to do something about their health to try to make up for lost time.
Right.
So that's an interesting study from ASCO. And in a similar vein, the United States government just reported on longevity, how long people live.
Right.
So I don't know, did you hear about that this week?
I didn't hear about it, but I do know a little bit about that word. So this conversation I can shed some light on.
Okay, so tell me, what do you know about longevity?
Well, the amount of time you live. Is that correct? Or?
Yeah, that's right.
Yeah, so everybody varies, obviously, due to their health.
So let's say your great-grandfather was born 115 years ago, something like that. Is that fair to say?
Sure.
So my great-grandfather was born in 1888 in Eastern Europe and came to America. So someone who came to America, was in America in 1900, how long did they live?
A lot less time than we do now.
That's right.
Yeah.
So about 50 years.
50, okay.
And there's a new study out from the United States government that actually is analyzing that information and looks at whites versus blacks. So for other groups, it doesn't talk about it. I'll try to get that information for you. But the gap between the life expectation of whites and blacks is getting narrower and narrower, which would suggest that people are getting better health care. And actually, the gap is improving more, longevity is improving more for black people than white people, even though white people have a greater longevity. So in the 1930s, the difference was pretty large between blacks and whites. Most of the differences are because of heart disease, cancer, homicide, diabetes, and infant mortality. And those diseases accounted for half the disadvantage in blacks in 2010. So again, heart disease, cancer, homicide, diabetes, and infant mortality. And this was reported by the National Center for Health Statistics, which is a federal agency. And black people had made the greatest gains. So life expectation, how long you're going to live, was up since 1970. So that's probably a little before you were born. It was after I was born. But for blacks, they actually had an improvement of 17% in life expectation from 1970 compared to 11% in white people. Why is that? What would you think?
Does it lead back to the healthcare issue?
100%.
Okay.
So there's less AIDS going on now. There's less homicide. For example, New York now is the safest it's been, and
Right.
many large cities are much safer.
I would have to also say with the issue of homicide, it must be in specific regions or geographics must play a role in that.
Right. So when you have the homicide rate falling, I think New York is the lowest rate in history.
Yeah.
Recorded history. So it's obviously letting people live longer. Blacks still have higher rates of heart disease, but they're benefiting increasingly from treatment. So life expectation for black people was 75 years in 2010. And just in 1970, so I remember I graduated high school approximately then, it was 64 years, which is really dramatic. And for white people, life expectation rose from 72 years to 79 years. And as I alluded to before, in 1930, life expectation for blacks was only 48 years.
Wow.
So you think back not so long ago.
Yeah, it's not too long time ago.
Most people's grandparents' age, they were living 48 years on average, blacks, 60 years for whites. Infant mortality, so babies dying, were a big part of the gap in the black community. And the infant mortality rate fell by 16%. And heart disease still is the biggest deterrent or drag on black life expectancy. So of the 3.8-year difference between blacks and whites, 1 year was due to heart disease. And the second was, take a guess.
Diabetes.
Cancer.
Okay.
Cancer. And about 8 months was due to cancer. So again, it talks about what you need to do to get screened for cancer and reduce your cancer risk. One thing was what we just talked about earlier was getting CAT scans for smokers, trying to find those cancers. Lung cancer is one of the top killers in America. So if you really find that cancer, detect it early before it spreads, you'll change the natural history of the patient's life. So those are two interesting studies that came out this week. I want to talk about some interesting patients that I spoke to this week, and those are new. One is a man who just called me from Israel, and he had an acoustic neuroma. Do you have any idea what that is?
Not a clue, doctor.
Well, acoustic. Guess what acoustic is?
Sound. Something to do with sound.
Sound and neuroma.
I don't have anything for you there.
Okay, so it's the nerve that carries sound in the brain.
Okay.
So you can get a tumor of the nerve, and it's usually a benign tumor called an acoustic neuroma.
Okay.
And this man came to us 15 years ago. He's a music conductor. So you can imagine, here's a music conductor who's losing his hearing, and his tumor is almost 4 centimeters, 3.8 centimeters in size.
Is that quite large?
Yeah, it is quite large.
Okay.
So 1 inch is 2.54 centimeters. So 3.8 is almost 1.5 inches.
Right.
So imagine in your brain to have 1.5 inches, and I'm showing John what 1.5 inches is like. That doesn't belong there.
Yeah, certainly something I would take very seriously.
Okay, so the brain is locked in the skull. The skull doesn't usually move. So as tumors get bigger and bigger, they push on the surrounding tissues.
Right.
So there's something called the brainstem in all of us humans. And the brainstem is probably the most primitive part of the brain, but probably one of the most important parts of the brain. So as a tumor gets bigger and bigger, it not only harms the hearing nerve, but also the adjacent nerves, the facial nerve, which controls the face, and the trigeminal nerve, which controls sensation to the face. The facial controls movement of the face. So most parts of the body have one nerve that moves it and another part that senses.
Right.
Okay, so as the acoustic neuroma gets bigger and bigger, it can cause more and more harm. So with surgery, most people who have surgery for acoustic neuromas lose all their hearing. So for this music conductor, this man is exceedingly sensitive to sound. He plays the violin. He conducts an orchestra in Israel. And the last thing he wanted was to lose his hearing. So I remember vividly calling him in Israel. It was daytime in America. It was midnight in Israel, and told him that we reviewed his case and we thought he was a proper candidate. And he actually came for treatment 15 years ago. We have a lot of patients coming from overseas. And he had 5 treatments. So we have a unique program for acoustic neuromas, and it's called fractionated brain radiosurgery, where we send in beams of radiation to hit in this case, a benign tumor. And we treat a lot of benign tumors. And so now he called me yesterday to follow up. And the answer is, we can imagine what the answer is. He's doing great.
Good.
His hearing was restored. His hearing was fully restored. So the tumor was able to shrink down and get pressure off the hearing nerve, so he has bilateral hearing. A lot of times we don't think or we take for granted bilateral hearing, but when you have bilateral hearing and you're walking down the street and someone honks at you, you know if they're coming from the right or the left or front or behind. So it improves your quality of life a lot. And it means that you can talk to people on either side of your body, right or left. means it can even save your life if you're walking across the street and the car's going to hit you and someone shouts, "Watch it." If you don't have stereo hearing, you don't know which way to watch it.
Right,
you know?
right. No direction.
And there's no direction. Yep. So stereo hearing is a major quality of life issue that many of us take for granted. So this man certainly doesn't. He gets MRI scans on a regular basis to show that the tumor has been receding over all these years, keeps on shrinking. He's done well. And our studies actually show we haven't had any recurrences after 5 years.
Wow.
So our success rate for acoustic neuromas is about 97%.
Outstanding.
Yeah. So we have actually the world's largest experience with fractionated radiosurgery for acoustic neuromas. So it's an interesting disease. For new or recurrent brain tumors, Radiosurgery New York specializes in non-invasive radiosurgery. First in New York with painless, fractionated brain radiosurgery, we have decades of expertise in brain tumor treatment. Hi, I'm Dr. Gil Liederman. Critical to every patient, every family are results and quality of life while avoiding radical surgery. Our brain radiosurgery may be used even if prior surgery, chemo, or radiation didn't work. And our radiosurgery experience includes treating thousands with brain metastasis, glioblastomas, acoustic neuromas, meningiomas, and more, with no cutting, no bleeding. Our brain tumor treatment is outpatient with most insurances, Medicare, Medicaid accepted. A fresh second opinion could change your life. For brain tumor treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the brain tumor. Call 212-CHOICES, 212-CHOICES to hit the brain tumor. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Liederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery New York, super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Liederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Liederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Liederman, we're back.
Good morning. Welcome back, John. How are you?
Great, doctor. How you doing today?
Fine, thank you.
Wonderful.
So there's more news. There's more cancer news. Did you hear about Michael Douglas and his cancer?
Very little of what I read in the Post,
Okay.
and I really can't tell you too much about it.
Okay, so a few weeks ago, he came back and he said that actually oral sex caused his cancer.
Right.
Did you hear about that?
That was kind of the gist, and that's pretty much the start and the finish to what I know.
Right. So there's a huge epidemic going on right now in America. And traditionally, cancers of the head and neck area, so the throat, the tongue, the tonsils, the back of the throat, those were cancers that mainly affected people who smoked and drank alcohol. And those were the main